Thank you, Dr. Stifelman. 2020 marks a momentous year. It's 20 years since we first started doing robotic surgery at Hackensack University Medical Center. Today, it gives me privilege to talk about a novel 3D kidney imaging technology that we use for robotic surgery. Historically, we use CT scans, which provides a slice-by-slice two-dimensional image as seen on the right. And from that image, it gives us information about kidney tumors, the location, the size, orientation, as well as the spatial orientation to relative structures, such as blood vessels. We have to take that two-dimensional image and create a mentally reconstructed three-dimensional image for us to pre-operative plan an operation and think about intraoperative scenarios. Even the best two-dimensional imaging is not good enough to allow surgeons to conceptualize the preoperative anatomy and intraoperative scenarios that we can encounter when we're operating on the kidney. A model like this is a 3D printed model. While it's great and produces a lot of information for us, it's also very costly and time-consuming to produce for every single case. It's a privilege to talk about a novel technology called IRIS. What exactly is IRIS? It's an application that delivers a three-dimensional reconstruction based on a CT scan that has thin slices. The software creates a three-dimensional model based on the CT scan, and it allows us for preoperative surgical planning as well as intraoperative display of the kidney and the tumor and the surrounding structures while we're operating robotically. Hackensack University Medical Center is a world leader in robotic surgery. We are one of only 5 institutions in the country to have this technology, and we were one of the first 2 institutions to acquire this IRIS technology. What we can do with IRIS is that these three-dimensional renderings are able to be seen on an iOS device, such as an iPad or an iPhone. We can then manipulate the images and remove various layers to allow us to see the different structures. I love using this technology to talk with patients, to discuss their tumors, their anatomy, and the surgical approach in terms of how we can best operate on the kidney and remove a tumor while preserving maximum function, which is exactly what we try to do with every kidney surgery. The operation is called a partial nephrectomy, and intraoperatively, we can view the 3D images on an iOS device, or we can directly plug it into the robotic surgical console so we can see the 3D reconstruction side by side as we're operating on the kidney using our robotic instruments. The IRIS technology helps us identify a number of different structures. For example, the kidney parenchyma, which is purple, the veins, which are blue, the arteries, which are red, the collecting system in the ureter, which are yellow, and the tumor in this case, which is orange. The layers can be removed to assess the tumor invasion. For example, the image on the left shows the kidney with the tumor and the surrounding structures. If we remove the kidney parenchyma, or the meat of the kidney entirely, we can see the tumor is separate from the yellow, which is the collecting system in the ureter, and it's far away from the blood vessels as well. This is another illustration showing how I can see the kidney with its arteries and veins. If I want to make those veins go away, absolutely, now I can see through the veins. If I want to make the veins go away completely and see just the arteries, I can do that as well. What if I want to see the kidney from the back, from the reverse side? I can do that as well. Let's say I want to zoom in on particular vasculature of the kidney. Well, I can do that as well. I can see the veins, I can see the arteries, I can rotate this in any dimension I want. And as we can see in this image, you can see the arteries through the veins themselves. Pre-transplant kidney donation evaluation for renal masses can definitely be an asset for this technology. In fact, earlier this year, we were scheduling a patient for a kidney transplant. The donor, who had a CAT scan, was found to have a mass. The CAT scan images on the left and the MRI images on the right could not determine whether the mass was coming from the kidney or from the collecting system where the urine is made, or whether it was outside the kidney. So the decision was made that this patient was not a viable candidate to donate her kidney. But using the iris technology, we were able to do a three-dimensional reconstruction, and we were able to zoom in on the tumor. And as you can see, the tumor is arising from the kidney. That's the orange structure in the center of the screen. And we noticed that it was not involving the blood vessels or the ureter. Using this technology, we were able to schedule this patient for a robotic nephrectomy, which means removal of the kidney. And what we did was a back table excision of the tumor. Knowing that the tumor was arising from the kidney, we were able to take the tumor out and send it to the pathologist. When the pathologist determined that the tumor was benign, we called the recipient in the very next day while the kidney was on pump, and that patient was able to receive his kidney transplant. So 2 lives saved at the same time. The patient's life from a tumor that was growing in her kidney, and the recipient's life from needing lifelong supplementation or dialysis. This is another instance where a patient had a small tumor deep within the kidney, and as you can see in this video, this is the kidney, but the tumor is not visible at all. Using the iris technology, we were able to see the orange tumor at the right-hand portion of the kidney. And this allowed us to plan intraoperative resection. So using an ultrasound probe and the iris image, we were able to determine where to access the kidney so that we can remove that tumor itself. And sure enough, this patient, who normally would have had her kidney removed at most institutions, was able to save her kidney and receive a partial nephrectomy, which means removing just the part of the kidney that had the cancerous tumor. This is another case where this patient has very complex vasculature, which means complex blood vessels. And you can see by the image on the right, you can see the arteries and the veins, and robotically we can identify exactly where those arteries and veins are, knowing where they were on the 3D rendering. There was a small branch illustrated by the arrows leading to the tumor, and once we were able to cut off the blood supply to the tumor, we were able to remove the tumor and salvage the kidney. Again, a technology which allowed us to do a partial nephrectomy, which otherwise I think I would have maybe subsided or maybe agreed upon doing a complete kidney removal. Salvaging kidneys and preserving kidney function is really what we do at Hackensack University Medical Center when we do robotic kidney surgery. And at 6-month follow-up, you can see this is another 3D rendering using the iris system, and you can see how the portion of the kidney has been removed with the tumor and the rest of the kidney looks exactly intact. So again, another advantage of this iris technology. What about research and prospective studies? We're innovators at Hackensack University Medical Center Urology, and we are actually looking at preoperative surgical planning and intraoperative surgical navigation. And we're looking at iris in terms of its clinical utility, in terms of interpretation of the kidney anatomy, providing information for a surgical approach, allowing us confidence with the procedure that we select to do, seeing if this technology can facilitate the planned procedure, as well as providing information intraoperatively, and most importantly, having an impact on the clinical outcome. So, as I said before, we're pioneers, we're innovators. We always want to push the envelope when we do robotic surgery at our institution. So some of the potential future applications can be for kidney cancer, which is what we're using it for currently, for kidney cysts, for living kidney donation, as I illustrated in the first example today, for ureteral tumors, tumors in the ureter, for kidney or ureter blockages, and many, many more that we're still investigating. When we look at new frontiers in robotic technology, Hackensack is really leading the pack. And as a world leader in robotic surgery, new technology comes about. We take it, we embrace it, and we offer it to our patients. The latest advances in robotic technology, specifically in iris imaging for robotic kidney surgery, can lead to better clinical outcomes for patients. Thank you very much for allowing me to present today, and I'm free to take any questions.